Dedicated resources to this fight. We've developed and employed new and innovative techniques to investigate, prosecute, and convict those involved. Treatments that are either easily abused or more specifically abused.
We've seen other things with nerve conduction studies. It is a proactive approach. We're finding schemes where everybody is in on it.
Follow the money, and quite frankly, we're using every tool we have in our disposal.
It was a $72 million fraud. A large number of people, if not everyone involved, is part of the scheme.
They received over $35 million. There were arrests in four other districts, indictments in four other districts, and the total fraud amount is estimated to be over $160 million. I think the data analysis has helped in two ways. In this case in particular, it allowed us to understand the full scope of the criminal enterprise. There were these fraudulent clinics opened in at least 25 states.
$1 billion a year in fraudulent hits on the insurance companies. All they do is bill insurance companies fraudulently. Nerve conduction test fraud, they would try and bilk the federal government and the state governments on Medicaid and Medicare fraud as well.
Congress just authorized enhancements to the federal sentencing guidelines for healthcare fraud offenses. We're sending the message, we're putting people in jail, and it's not just the clinic owners, it's not just the patient recruiters, it's the medical professionals who are involved. Doctors are involved in the fraud, the nurses are involved in the fraud. It's constantly moving. When one fraud ends, something else inevitably is going to pop up. Beneficiaries who they're actually not seeing, but they're billing for visits, $200 million worth of claim. All of them were fraudulent claims, intentional misconduct.